John, we've now heard about the pulmonary and nutritional care needs for our patients with SMA. Can you review the role of therapies like physical therapy and occupational therapy for our patients?
I think the key here is that it really does take a village to care for an SMA individual. And we want to make sure that we're respectful of their care context, because this isn't universal depending on where somebody lives with SMA in terms of how they would access all of these different options. The primary care provider plays an essential role in terms of things like vaccination for things like pneumococcus, maybe RSV prophylaxis when they're younger, and also the annual flu vaccine, and is often the first person that patients access if they have concerns for new symptoms, so really needs to be abreast of any care considerations. But in most places, a neurologist is the care home, leading a team of people in the clinic to try and optimize function for people with SMA. And this is where our rehabilitation colleagues are so essential, because weakness is universal in SMA. And so we really need to optimize day-to-day function as much as possible in the context of that weakness. Also do appropriate therapeutic interventions, whether it be bracing, stretching, different therapeutic exercise, to both maintain function and avoid development of things like contractures, which can end up being limiting over time, especially if somebody is gaining strength on some of these new treatments that we have. It's also common in our patients with more severe forms of SMA to develop scoliosis of the spine and develop contractures that need intervention in various joints, whether it be hips or ankles. So this is where our orthopedic colleagues can often be very helpful if the scoliosis is progressing, helping with stabilizing the spine either through bracing or through surgical intervention. And so in terms of the rehabilitation management, that's one aspect of an interdisciplinary team. Pulmonary and GI would be another. But there's lots of other folks that we end up involving in the care also. We haven't explicitly said it yet, but for the vast majority of patients with SMA, cognition is not affected whatsoever. But the psychosocial aspects of living with this disorder are really important to keep in mind. And this is where our social workers and sometimes even behavioral health intervention is needed at various stages, whether it be for the person living with the disorder themselves as they go through stressful transitions in their life or are trying to cope with other stressors that come up in the context of living with weakness, or also their caregivers and loved ones and those in the community that interact with them that may be also affected by different aspects of living with a disorder like SMA. And so this part of the care is very important to keep addressing and follow up with patients and be very open in addressing because it can lead to significant quality of life issues if it's not addressed appropriately.
I think that your comment, "it truly takes a village," is incredibly true. And there are multiple members of our team that make it possible for our patients to survive and thrive and develop, especially in an era where we now have the opportunity to treat.